Good day everyone, my name is Chris Daniel M. Sumawang from BSN 1B and for today I will be conducting an assessment on the ears. So ang una natin gagawin is we need to assemble our equipment. We do need to have a otoscope with several sizes of ear specula. And ang next step natin is magpapakilala tayo sa ating pasyente and i-assess natin kung meron bang kakayahan yung ating pasyente na tumulong o mag-assist sa ating procedure. So, hi ma'am, my name is Chris and I will be your nurse for today. May I know your name po?
Francine.
Okay, Miss Francine. Pwede ko ba tingnan yung name tag? Okay, thank you po. After that, susunod na step natin is we need to perform hand hygiene and observe other infection control procedures. So, ang next step natin is we need to provide some privacy para sa ating patient. We need to close the curtains around bed or close the door to the room if possible. And our next step is we need to inquire whether the patient has the history of the following. So, ma'am, meron po ba kayong past or family history ng hearing loss?
Wala po.
Okay po. Meron po ba kayong nararanasang pananakit po sa inyong ears po ngayon?
Wala naman po.
Okay. Nakapag-take na po ba kayo ng mga medications po para sa ears dati?
Hindi po po.
Okay. Nakagamit na po ba kayo ng mga hearing devices po tulad ng mga hearing aids?
Hindi rin po.
Okay. Nakakaranas po ba kayo ng mga difficulty po sa pandinig niyo po ngayon para po maka-apekto sa pang-araw-araw niyo pong activities?
Hindi naman.
Okay po. Thank you po. Next, we will be assessing the patient's auricles. So the first thing that we need to do, ang gagawin natin is inspect natin yung auricles ng ating patient for its color, its symmetry of size, as well as the position. So para ma-inspect natin yung position, kailangan natin i-note yung level at which the superior aspect of the auricle attached to the head with the level of the eye. And for our next step, we need to palpate the auricle of the patient for its texture as well as the elasticity and for areas with tenderness. So ang gagawin natin is we will gently pull the auricle of the patient upward, downward, and backward. Ano yung lang po dito? Sasay po. Okay, thank you po. And yung next po natin. Okay, thank you po ma'am. So next, we will proceed to the assessment of the external ear and the tympanic membrane of the patient. So ang unang step natin using our otoscope, but for this instance, ang gagamitin lang natin ay pen light. Inspect natin yung external ear ng ating patient if there are presence of cerumen, skin lesions, if there are pus or blood. So next step is we need to attach the speculum to our otoscope. So hindi nga tayo gagamit ng otoscope. We will proceed to our next step. We need to remember o kailangan natin tandaan na if ang pasyente natin ay adult, ang gagawin nating assessment ay sa kanyang ears ay para mas straighten ang kanyang ear canal is we need to pull his or her pinna up and back. And for children naman, we need to pull their pinna down and back. And also, we need to hold we can choose to hold the otoscope upside down or right side up. So pag ang pinili natin ay right side up, with our fingers between the otoscope's handle and the patient's head. And para naman sa upside down, yung with our fingers and our ulnar surface of the hand against the patient's head. So for our next step, we need to gently put our pen light about 1/3 of the patient's ear. So tandaan din natin na we do not need to exert too much pressure sa magkabilang ears ng ating pasyente. Yan lang po sa side. Okay, thank you po. Ma'am, can you please face the other side po? Okay, thank you po. And for our next step, i-inspect natin ang tympanic membrane ng ating pasyente for color and its gloss. May ulit, ma'am. Thank you po. Next slide po. Thank you po. So now we will proceed to the gross hearing acuity test for the patient. So una natin gagawin is i-assess lang natin yung ating pasyente kung naririnig niya ba tayo sa ating normal voice. Ma'am, i-assess ko lang po kayo kung naririnig niyo po ang normal voice. Naririnig niyo po ba ng malinaw?
Opo.
Okay po. So kung ang pasyente natin ay hindi tayo naririnig ng malinaw sa ating normal voice, mag-proceed tayo sa performing ng mga different tests tulad ng watch taking test, Weber's test, Rhine test, and as well as the Romberg's test. So ang unahin natin is yung watch take test. Ang gagawin lang natin is i-ask natin yung patient to close yung isang side ng kanyang ears and ipaparinig natin sa kanya yung tick ng clock or ng ating watch for about 2 to 3 centimeters away sa kanyang ears or it's equivalent to 1 to 2 inches. Aalamin lang natin kung may naririnig siya and igagawin din natin yung procedure na to sa kabilang ears niya. So ma'am, ikakanda ko na po ang watch taking test. Is that okay?
Yes.
Okay po. Pang-close po natin yung ating pong right ear. Okay, thank you po. Naririnig niyo po ba yung ticking?
Opo.
Okay, thank you po. Sa kabilang side naman po ng ear natin, pakitakpan po. May naririnig po ba kayo?
Yes po.
Okay. Now we will proceed to the tuning fork test. Ang una nating gagawin is yung Weber's test. So, ang gagawin lang natin dito ay hahawakan natin ng ating tuning fork at its base and i-activate natin to by tapping it at the back of our head, malapit sa ating knuckles. Or pwede din natin siyang i-activate using our index finger and our thumb by stroking it. And next na gagawin natin is i-place lang natin ang ating tuning fork sa may top of the head ng ating pasyente sa kanyang mid point ng kanyang ulo. And i-ask lang natin siya kung may naririnig ba siya, kung mas malakas bang naririnig niya sa kanyang right ear o mas malakas ang kanyang naririnig sa kanyang left ear. Or pwede rin naman kung ang naririnig niya ay balance sa left ear and right ear. So ma'am, ikakanda ko na po ang Weber's test. Okay lang po?
Yes.
Okay po. Naririnig niyo po ba yung sound ma'am?
Opo.
Alin po ang mas malakas? Yung left ear po o yung right ear po?
Pareho lang.
Okay po. And now we will proceed to the conducting the Rhine test. So ang gagawin naman natin dito is papatakip natin ulit yung other side ng ear ng ating pasyente and susunod na gagawin natin is i-activate natin ulit yung ating tuning fork and itatapat natin ang tuning fork natin sa mastoid process ng ating pasyente and paparinig lang natin or ipaparamdam natin sa kanya yung vibration And sasabihin din natin sa kanya na sabihin niya if hindi niya nararamdaman yung vibration na nanggagaling sa ating tuning fork. And pagkatapos nun ay itatapat natin sa kanyang tenga yung tuning fork and i-assess natin kung may narinig na ba siya sa tuning fork. So ma'am, ika-apanda ko na po yung ating rhyme test. Okay lang po?
Yes.
Okay po.
Wala na po yung language.
May narinig po kayo?
Meron po.
Okay po. Sa kabilang ear naman po.
Wala na po.
Okay po. May narinig po.
Opo. Meron.
So, ang susunod natin gagawin ay yung room bridge test. Ang gagawin lang natin is, i-ask natin yung patient na tumayo siya with closed feet and yung arms niya nasa side lang. And i-assess natin siya kung ma-maintain niya yung kanyang balance or yung kanyang homeostasis kapag nakabukas yung kanyang mga mata or nakasara yung kanyang mga mata. So, ma'am, tayo po kayo. Closed feet po tayo, ma'am. And yung arms po natin nasa side. Okay. So, open po natin yung mata natin. Okay. And close po natin. Okay. So, we need to note the swaying as positive Romberg test. Ma'am, po na po tayo. Okay. So, now we will, for our next step, we need to record our findings to the client's record. And for our evaluation, the patient's ears was assessed accurately without any injuries. And the patient only experiences minimal discomfort. And for our documentation, we will need to record our findings to a piece of paper, a flow sheet, or a computerized record. Also, we need to report abnormal findings to the appropriate person. And also, we need to identify the site of assessment. And that would be all for the assessment of the patient's ears. Thank you very much.